Good morning, everyone. Today we're going to talk about constipation. Many of us may experience this, but rarely discuss it openly, and we're going to get to the bottom of it. So, insights again are from How Not to Age by Dr. Michael Greger. Presentation is by Tran, MD, and Tran, our medical assistant. So, constipation is the most common GI complaint in the United States. It leads to millions of doctor's visits and, believe it or not, 800,000 emergency room visits annually. It's a huge issue, especially for older adults, and it affects up to 30% of those over age 65, and two-thirds in geriatric care facilities, often due to a couple of things, including less fiber, less fluid, and less activity. So, beyond straining at hard stools, symptoms include abdominal pain, bloating, and nausea. Nausea and bloating because we're retaining a lot of the stool and giving a lot of time for bacteria to brew. Crucially, any signs of rectal bleeding during defecation must be checked by a doctor. It is a red flag sign that needs attention, and can range from things like hemorrhoids, to anal fissures to cancers or other inflammatory or infectious bowel diseases. Other serious red flags include intentional weight loss over 10% of total body weight in 3 months. So, if you lose 10% of your body weight without trying over 3 months, that is a serious red flag. Any family history of inflammatory bowel disease or colorectal cancer, sudden development of jaundice, yellowing of the skin, or new symptoms after age 50, or rectal tenesmus, which is a frustrating feeling of not being able to empty your bowels, even though they are empty. So don't strain yourself. Constipation is often dismissed, but it does impact our quality of life. And it is comparable to other conditions like osteoarthritis or diabetes. And despite this, many US adults with chronic constipation have never discussed their symptoms with a doctor. And often, these get to be overlooked for other conditions, but many people who believe that they're healthy may actually be clinically constipated. And one study in our state, Ohio, found that a quarter of healthy subjects reported incomplete emptying. And almost half experience increased straining with defecating, and alarmingly, over half of these individuals did notice blood on their toilet paper within the past year. And so, this is a problem that all of us may benefit from solving. So, beyond the immediate pain, there are serious consequences. Have you heard of hiatal hernias and acid reflux? So, hiatal hernia is a weakness in the diaphragmatic wall, and thus the passage of the esophagus through the stomach. There is an area where the stomach can actually go into the chest, and instead of where it's supposed to be in the abdomen. And that causes acid reflux because mechanically the stomach should be below the diaphragm, but when it is pushed with constipation chronically and just a lot of pressure, pushing upwards causes part of the stomach to go into the chest, increases reflux. Um, there are other conditions like hemorrhoids that can be caused, varicose veins from the pressure and straining. Varicose veins in itself is associated with increased risk of blood clots in the legs. And then other conditions like diverticulosis, which is outpouching of the colon. And diverticulosis is important because over time, this increases your risk of diverticulitis, which is infection of these pockets that requires antibiotic treatment, sometimes even surgical management. So, it also poses cardiovascular risk because just 15 seconds of straining can significantly cut blood flow to your brain and heart, potentially causing fainting or, in very rare cases, death. But severe constipation can also lead to dangerous fecal impaction, or obstruction. So, that's why sometimes patients faint while they're defecating. So, how to make changes so that we're not straining? We'll talk about that soon. So the good news is the solution is pretty simple, and that's prevention. A fiber-rich plant-based diet promotes effortless bowel movements, drastically reducing pressure diseases. So remember, don't strain yourself. Your health depends on it. And let's talk more. So, constipation is often seen as a nutrient deficiency disease, with fiber as the missing nutrient. Less than 3% of Americans meet the recommended daily fiber intake, indicating insufficient consumption of whole plant foods. And whole plant foods is the primary source of fiber abundance. And this is why that those on strictly plant-based diets are 3 times more likely to have daily bowel movements. Increasing daily fiber intake by just 3 grams per adult, and that is equivalent to a quarter cup of beans or a bowl of oatmeal, could potentially save billions in medical costs related to constipation. The best way to get fiber is directly from the produce section, so and even better from the bulk bins filled with beans and whole grains. This is what Dr. Greger says. So fiber does far more than just keep you regular. High intake from whole foods significantly reduces your risk of major health issues, including heart disease, our number one killer, with every 7 grams of fiber cutting that risk by 9%. It also helps protect against cancer, obesity, diabetes, depression, and even premature death. So, and how does it do that? So, when your food is regularly moved and digested, it decreases, the time for which it is in your gut. So after it's digested, it's just poop material. And that, isn't good to hang out in anybody's gut for a long term. So, causes for colorectal cancer. Obesity, like you want everything moving through, so that it has enough absorption, but not, staying too long. And that messes with your microbiome as well, leading to obesity and diabetes. So, some people ask me, should I just take a fiber supplement? And while that can help with constipation, there is an important point that I want you guys to know, and that is they do not offer these other widespread chronic disease benefits. So, studies consistently show that protective effects come exclusively from fiber found in actual food, not isolated fiber or supplements. And the difference is because whole food fiber acts like a smuggler, and that's how Dr. Greger describes it. It encapsulates vital nutrients within plant cell walls, and it delivers these fibers to those precious wrapped nutrients directly to your beneficial gut bacteria. Supplements like psyllium do not have this bounty for your microbiome, meaning you miss out on a lot of the benefits. So you're getting the fiber, but you're not getting the associated benefits. So, like, say you're eating celery, you're getting the fiber, but you're getting all the nutrients, you're getting all of the associated structures of the fiber to actually help with your digestive process, which cannot be replaced by a supplement. So, one thing that's really easy to do that I would encourage you guys all to try is ground flaxseed. It is a powerhouse of fiber and it can significantly benefit your health. It has been shown to improve constipation, type 2 diabetes, and even high cholesterol. So, a 12-week study in constipated diabetics found that just taking 1 tablespoon of ground flaxseed daily led to remarkable improvements, and that's less pain, straining, hard stools, constipation relief, an average 8-pound reduction in 12 weeks. That's unbelievable, a 25-point drop in fasting blood sugar, and that is lowering your hemoglobin A1C by 1.8%. And that is just in 12 weeks, which, I mean, like I give a lot of diabetes medicines all the time, and, not many of them can beat 1% lowering hemoglobin A1C, but this lowers it by almost 2%, which is pretty amazing by just 1 tablespoon of ground flaxseed. Um, it has a 17-point decrease in bad LDL cholesterol, which is very significant. It that can be a difference between, certain dosages of cholesterol medication changes. And then flaxseed stands out because it is better than other fiber sources. It actually beats psyllium. So there was a direct comparison study that showed that flaxseed actually outperformed psyllium, and that's 10 grams daily, for constipation relief, weight loss, blood sugar, and cholesterol benefits. And it's 4 times cheaper. It's also more effective than lactulose. So I do prescribe lactulose for certain patients who have a lot of constipation. Um, Flaxseed increased bowel movements from 2 to 7 per week, surpassing lactulose's 6. And then while high fiber rye bread can help with constipation by reducing transit time, it might cause initial flatulence and bloating. Flaxseed, however, offers like all this broad range of benefits and it doesn't have the side effects because your gut tends to adapt very well to flaxseed. Now, I do want to say that for my patients with irritable bowel, I wouldn't go directly to 1 tablespoon a day of flaxseed because you already have an underlying problem. Like if you have constipation without irritable bowel disease or inflammatory bowel disease, then taking 1 tablespoon of milled flaxseed per day is going to be helpful. If you have underlying bowel disease that were mentioned, then probably trying a little bit of it to see how your body tolerates it first, and then slowly ease into it. You can always talk to your physician to help with this process as well. Prunes. Everybody have heard of prunes and prune juice. So decades ago, the special recipe was created for nursing home residents. A simple mix of applesauce, unprocessed wheat bran, and fruit juice given in small daily doses at about $77 a year. It was much cheaper than psyllium, which can cost nearly double that. So, how good is the science on prunes? So, a study found that eating about 10 prunes a day worked better than psyllium for improving regularity. The prune group went from having 2 bowel movements a week to 4, while the psyllium group only went to 3. And the researchers even suggested that prunes should be a first line treatment for chronic constipation. Um, and this is something that, like in our older adults, you can safely try. In our babies, you can safely try this as well. Yeah, so some patients just do not love the taste of prunes, and I can understand that. So that's why we talk about mangoes. So prunes aren't the only solution because another study found that eating 1 fresh mango a day could also beat out psyllium. Not only did the mango work better for constipation relief, but it also had a significant anti-inflammatory effect, and it decreased key inflammatory markers in the blood by over 20%. And this is likely because it has prebiotics in the mango pulp, which feeds the good bacteria in your gut. And a 2020 study confirmed this, showing that a mango a day significantly increased the amount of good bacteria like lactobacillus. Of course, prunes and mangoes have a lot of sugar content in them, so it would be something to use in moderation in my patients who already have diabetes. For my diabetic patients, I would recommend the ground flaxseed instead. So, when we're looking for a solution for constipation, maybe we don't need to look any further than the produce aisle. A simple, natural approach using fruits like prunes or mangoes can be as effective, if not more so, than commercial products. And it comes with a lot of extra health benefits, like mangoes and prunes, lots of antioxidants to help with cancer as well. So for another thing, the pooping position. So for generations, particularly in Asian and African cultures, squatting has been the traditional posture for defecation. I mean, we also see this natural posture in a lot of our animals. So in contrast, Western societies have largely adopted the sitting on a raised toilet seat. But the small difference can actually make a significant difference, impact on the natural process of bowel movements. So there is a natural anatomical feature called the anorectal angle. a natural bend at the end of the rectum, and this kink actually is crucial for maintaining continence and preventing accidental defecation. So, but when we sit upright on a toilet, this anal rectal angle does not sufficiently straighten. And because it doesn't straighten, that means the stool has to make this like very awkward 90-degree turn to exit. And essentially, it works against our natural body's design. And so we are not emptying completely. And it's akin to trying to drive a car while parking brake is still particularly engaged, kind of a deal. You are not allowing its natural way of coming out. So, when in the squatting position, the anal rectal angle naturally straightens out, creating a more direct and then unobstructed path for waste to pass through. And this makes defecation easier and more complete. So, while manipulating this angle by squatting or leaning forward can definitely help, just also putting a small stool and will also help with this. It's also important to make sure that the underlying cause of stool consistency is treated as well. So, making sure that you're consuming adequate fiber from whole plant based foods is key, and then adjusting your pooping position. So, as we conclude today, let's reinforce some core messages. Effortless bowel movement is the cornerstone of health and a truth that has been acknowledged from ancient times to modern clinics. And the widespread issue of constipation can lead to serious health consequences, hernias, cardiovascular risk, diverticulosis, hemorrhoids, varicose veins. The good news is the solution is beautifully simple, and that is prevention. So, constipation is a fiber deficiency, and less than 3% of Americans get enough, largely due to insufficient consumption of whole plant foods. So, embracing a fiber rich plant based diet will help. And you can do this by taking flaxseed or prunes, mangoes, and that also reduces your risk for major health issues like heart disease, cancer, obesity, diabetes, and supplements cannot replace whole foods in this because they act as smugglers, delivering vital nutrients to your gut bacteria that supplements simply can't. And so, for true fiber power and comprehensive well-being, choose whole plant foods. Don't strain yourself, and make sure that you are using a stool on the toilet, and so your gut and your overall health will truly thank you. So, thank you so much for watching, and we'll be back to talk to you again next month. Have a blessed day. Bye bye.